everyone, it's Kelly, one of the doctors at WholeHealth. I think I've had a chance to meet you all in the office now, or at least many of you, but for those of you who haven't met me, I started in February of 2020, right before COVID hit, and I didn't get to meet anyone in person. So I'm here today wishing you all a happy fall, and to all of our students, a healthy and happy start to the school year. As we enter into the fall months, there are still many questions regarding health and safety, especially for our school children. We at WholeHealth are prepared and eager to assist. In our time here, I want to cover the latest evidence-based information regarding back to school, updates on the COVID pandemic, as well as best practices to keep you and your family safe. In July, the Virginia State Health Commissioner and the Virginia Superintendent of Public Instruction gave general guidance for phased reopening of Virginia schools. However, they left the final decisions about reopening in the hands of the local school boards. Here, the Albemarle County School Board voted in June to reopen schools on Tuesday, September 8th. The board approved starting schools in Stage 2. This means that virtual learning will be available for most students. Only select populations of students will be granted the option to access in-person instruction. A very limited number of students include those without internet access or limited access that cannot be resolved by available means. Students with special needs who cannot access their curriculum virtually as determined by their individual education plan or IEP, and English learners in grades 4 through 12. There will be no in-person extracurricular activities nor in-person sports at this time. This county school board has made the explicit recommendation that all students and employees wear a mask or acceptable face covering at all times regardless of physical distancing. In a school building, in another school facility, or on a school property or campus, or in school vehicles or buses. For more information on what individual stages of opening mean and up-to-date information, please visit www.k12albemarle.org. For our local Charlottesville community, UVA and the return of the university students have an outsized impact on all of us. So I want to update you on the latest data we have coming out of UVA. Since August 17th until the last week, which was September 24th, there have been 648 total cases of COVID in the UVA community, including faculty, staff, students, and contract employees. Of those, 590 are student cases. According to the UVA COVID tracker, we are averaging 25 positive cases a day as of last week. Like many universities across the country, UVA has been open and transparent about their ongoing virus management plans. You can see the specifics of what they are doing at www.returntogrounds.virginia.edu. And I want to make an additional comment here, just stating that many of these students are following social distancing guidelines, but there's always going to be outbreaks when you have people coming from all over the country to live in a congregated area. So we're going to go ahead out and zoom statewide. The Virginia Department of Health has developed, in conjunction with UVA, a predictive model that updates weekly. The latest information is from September 25th. This model shows that there has been an increase in weekly cases likely due to school reopening, the flu season, as well as changing weather patterns. This means that the likely peak of this current trend will be the week of November 1st, with 8,558 weekly cases statewide. If cases continue in this trajectory, we are expected to top 205,931 cases by Thanksgiving. I know that was a lot of information, but I just want to emphasize that the more facts and data we have available, the better decisions we can make. So, to go over where we are right now, there is still no available vaccine to prevent COVID-19, and even if one is on the horizon in the next few months, distribution remains a challenge, and it could be months before we actually have adequate distribution. The virus is spread from person to person when they are in close contact within 6 feet via respiratory droplets that are made when an infected person coughs, sneezes, or talks. There is concern that the virus can be spread by people who are infected but have no symptoms. And to summarize all of this, the best way to prevent illness is to avoid being exposed to the virus in the first point. If you are exposed or think you have been exposed, we can help. Here at WholeHealth, we offer tests to those worried about current infection, as well as tests to determine if you have been infected in the past. To make sure that our staff and patients are safe, we offer car visits, where you can be seen, tested, and treated by our nurses and doctors in your car. We also offer virtual visits for patients who wish to be cared for from their homes. And in the event of a virtual visit that we feel requires an in-person visit, we can change it to a same-day in-person visit as needed. For the kids, we offer well child checks as well as conduct sports physicals when sports eventually return. I want to make a note here to mention that I think the well child checks are very important. There's some concern that with many kids missing out on their routine vaccinations, there might be a new surge in vaccine preventable illnesses, which we of course want to avoid. And we can be flexible. If you're worried about bringing your kids into the office, we can see them virtually, and then we can have them get their vaccines outside or something along those lines. Just call us and we'll try to figure out something that works for you. We want to care for you no matter where you are. Just as a reminder, to prevent the spread of the virus and to keep you and your family safe, please wash your hands often with soap and water or with hand sanitizer that contains at least 60% alcohol, especially after you have been in public places. Wear a mask to protect yourself and others in public spaces, especially in enclosed spaces like a grocery store or office. Monitor symptoms and take your temperature if symptoms develop. I want to make some notes here. You will notice that I'm not wearing a mask. We debated back and forth because in our office we are wearing masks every day, all of our staff. However, we thought it would be beneficial for you to be able to see my mouth in the video. Sometimes it's a little bit easier to understand what someone is saying if you can see their mouth, so we made an exception for this. Also want to touch on what we're doing in the office to keep you safe. We do clean the rooms in between each patient. Our staff and all patients are wearing masks in the office, especially when interacting with each other. We have plexiglass blockades at the reception area to make sure that you're not having direct face-to-face contact when you don't need to, like when checking in. And our waiting room is not often very full, but if you come and you're concerned that there is not an ability to physical distance, then you can wait in your car as long as you let us know, and we'll call you and bring you straight back to the room. And for someone who's particularly concerned, for example, if you're immunocompromised or you feel that you're very high risk, or if you just don't feel comfortable coming in the office, we, again, can be flexible. So please let us know. We want to make sure that you're getting your health care, and we'll do whatever we can to help you with that. We are entering the flu season right now, and with the double hit of influenza and COVID, it is more crucial now than ever that you receive the flu vaccine from us here at WholeHealth. The flu vaccine does not protect you against COVID, as they are different viruses, but the dangers of the flu still exist. It's especially important to keep you out of the office as much as possible. As much as we love to see you, we also don't want you to have to be coming in here when you have the flu, because every time you go anywhere, your chance of contracting COVID increases. So getting the flu vaccine, which is a quick in and out visit at our office, can help prevent a longer visit to our office, or in a worst case scenario, a visit to the hospital. We're also concerned that there can be cases of COVID and flu together, which we definitely want to avoid. Thank you for listening to our COVID update. From everyone here at WholeHealth Medical, we're ready to care for you wherever you are, and we wish you a wonderful and healthy fall season. Please, as always, reach out to us with any questions. We'd love to hear your thoughts. Thanks. Bye, guys.